students, so today we learn regarding the physiology of menstrual cycle or female reproductive cycle. So regarding the female reproductive cycle, it consists of, or it is a compromise or encompasses of the ovarian cycle as well as the uterine cycle. So uterine cycle is also known as a menstrual cycles. So ovarian cycle, it was occurs in the ovary or each any one of the ovary. So where the follicles are developed, okay, and they are matured. So then they are converted into a ovum, or the ovarian cycle is responsible for the formations of the ovums. And regarding the uterine cycle, it was occurs in the uterus. It was responsible for the preparations of the environment in the uterus that was favor the fertilized ovum or the embryonic development or gestations. Certain changes will be occurs in the uterus. They can create the favorable environment. So that was helpful for the development of the fertilized ovums or development of the embryo. So that changes is occurs. So that was known as the uterine cycle. If the ovum is not fertilized, then that changes was responsible for the menses or menstrual flow. So due to that, it is also known as a menstrual cycles. Okay, but the changes are the favorable environment that was created in the uterus. If the fertilized ovum is reaches, means that was helpful for the development. If unfertilized ovum is reaches, means then it can responsible to cause of the menses or menstrual flow. So that's why the uterine cycle is also known as a menstrual cycles. So regarding the ovarian cycle, it is a series of events so that occurs in the ovaries, okay, during and after the maturations of an oocyte. Okay, so there is a series of events. So they are responsible for the formations of the matured follicles. That series of events is known as a ovarian cycle. It was responsible for to release of the ovum into the fallopian tubes. And regarding the uterine cycle, it is a concurrent series of changes in the endometrium of the uterus to prepare for the arrival of the fertilized ovum. So that will be developed here until the birth. So whatever the development for ovum, whatever the environment is required. So they are mainly required the estrogen, progesterone, okay, main hormones. So that favorable environment, okay, also as well as the larger surface area. So that is required in the uterus. So that was prepared in the this cycle. So that's why it is known as the uterine cycle. If it reaches unfertilized, then it is known as the menstrual cycles. Okay, and regarding the female reproductive cycle, it is the encompasses of the both ovarian and uterine cycle. Okay, it is a combinations of ovarian and uterine cycle. So that was known as the female reproductive cycle. That is the hormonal changes, so that can regulate them both ovarian cycle as well as uterine cycle, and also related cyclic changes in the breast and the cervix is occurs. So that was changes in the series. So that was known as the female reproductive cycles. So typically the length of the female reproductive cycle is 24 to 36 days. Okay, so next one, so regarding the hormonal regulation of the reproductive cycle. So as you know, the FSH, LH, so they are secreted from the anterior pituitary gland under the influence of the hypothalamus. Hypothalamus through a positive feedback mechanism, through a negative feedback mechanism. So it was involved to control the functions of the entire pituitary gland with the help of by secreting the hormone that was known as the GnRH. Okay, in the female reproductive cycle when the female reaches to the puberty, so on that time hypothalamus can start to release of the GnRH, nothing but gonadal releasing hormone or releasing factor. Okay, so these GnRH, it can stimulate the entire pituitary gland, then so that was involved in the secretions of the FSH and LH. So FSH, it is required for the or play an important role in the development of the ovarian follicles. So those are responsible for converted into secondary follicles, then Graafian follicles. So Graafian follicles are nothing but the matured follicles. So those only they are involved in the release of ovum. So that was regulated by the FSH. And also the follicular stimulating hormone, that is the FSH, also stimulate the ovarian cell to secrete an estrogens or oestrogens. So FSH, it also secrete the Graafian follicles or dominant follicles. Okay, so to secrete the estrogen, so that estrogen is required for the fertilizations of the ovum or fusions of the sperms with the ovum. So that hormone is also stimulated or secreted under the influence of the FSH. And regarding the LH, so that is also known as the luteinizing hormone. It is a interpituitary hormones. So this LH is also further, it can stimulate the development of the ruptured follicles. Okay, when they become the that is the Graafian follicles, then the Graafian follicles, so they are ruptured. The due to ruptures only they can release the ovum. So that ovum can be picked up by the fibra of the fallopian tubes. Okay, so after the rupturing of the follicles, certain processes occurs. Okay, that is nothing but the formations of the corpus luteum. It is one type of cell. That cell, it was involved in the secretions of the estrogen. Okay, the life of that cell is only 2 weeks. Okay, if it is not fertilized. If it is fertilized, that ovum, then the life of the corpus luteum is up to the pregnancy, it was increases. Okay, so that changes after the ruptures of the follicle cells. So that the formations of the corpus luteum. So that is the role of the LH. So luteinizing hormones. So it was involved in the formations of the corpus luteums. So the corpus luteums are only the cells. So they are responsible for the secretions of the estrogen, progesterone, then as well as relaxins, inhibins. So these hormones, so they are further play an important role in the growth of the embryo or pregnancy, even the deliveries. Okay, so those FSH, LSH, so among the FSH, it also involved in the development of the ovarian follicles. Then FSH along with the LH, so they can stimulate the ovaries, and also so they are initiate the ovulations. Okay, so they are maintain the further development of the ovarian follicles and their secretions like a estrogen and inhibins. And another side, already told you, like regarding the LSH, it can responsible for the formations of corpus luteum from the ruptured follicles or from the ruptured matured follicles. Okay, so then this corpus luteum, so it was involved in secretions of progesterone, estrogen, relaxin and inhibins. So whatever the hormones releases, so those are estrogen, progesterone, relaxins as well as the inhibin. So estrogen, so it is the female sex hormones. So it was involved in the development and maintenance of the female reproductive system, and as well as it is involved in the development of the secondary sex characters like distributions of the adipose tissues in breast and pubis, as well as the hair growth on the head and body, and also the broadening of the pelvis. So that is the role of the estrogen. Okay, and also estrogen, it was involved in the electrolyte balance. Okay, also it can assist the protein metabolism regarding the anabolic effect. And also the estrogen, it can lower the blood cholesterol level. It means it was helpful for to enhance the HDL and decrease the LDL, VLDL, cyclomacron, simply bad cholesterol. So that's why the female having the lower risk for to cause of the cardiovascular diseases, especially atherosclerosis, that was causes due to increase the bad cholesterol in the blood. That was the beneficial effect of the estrogen, that it can clear the blood plasma. So these are the various effects of the estrogen, so that was produced from the corpus luteum, from the ovary. And also it can secrete the progesterone. So progesterone is also secreted from the corpus luteum along with the estrogens. Okay, so it is also involved in the development of the secondary sexual characters and female reproductive organs. And also it was initiated the endometrium implantations of the fertilized ovum. So fertilized ovum, so when it is, reaches towards the that is the uterine, so where the endometrium development is required, so that can initiated by the progesterones. And progesterone, it has also acts on the mammary gland. It can enhance the milk secretions. So milk secretion from the mammary gland, so that was mainly depending upon the concentrations of progesterone in the body or in the female body. So regarding the relaxing, it is the another hormone, so that was comes under female reproductive system, secreted from the corpus luteum after release of the ovums from the Graafian follicles or dominant follicles. Okay, so these relaxins, it was mainly stimulate the smooth muscles in the cervix or in the pelvic regions. It mainly relax the smooth muscles like a pubic symphysis. So due to that, the relaxations of the smooth muscles in the pubic symphysis, the cervix can be enlarged, or the cervix size in the female reproductive system, so that was size was increases. So the increased size of the cervix, so that was helpful for the easy delivery of the baby. Okay, so delivery of the baby, so that was depending upon the cervix size. If it is small, then even the contractions of the uterine muscle, so that delivery cannot be occur. So on that time, the doctor, they can go for the surgery. Okay, so go for the surgery to deliver the baby. Okay, so that is depending upon the easy delivery, normal delivery of that baby. So that was depending upon the relaxing hormones. So if it is more secreted, it is the level is well during the pregnancy, then this relaxing, it can causes the relaxing smooth muscles. Due to that, the pubic symphysis is relaxed, so that was causes the enlargement of the cervix. And also the another side, the oxytocin, definitely, so that oxytocin, it can cause the contractions of the uterine muscle, then create the pressure, then due to enlargement of cervix, then oxytocin cause the uterine muscle contraction, then the delivery of the baby can be occurs. Okay, so that is the delivery of the baby or without scissoring, so that was depending upon the relaxins. Okay, then another hormone, so that was comes under the female reproductive system, so that was known as the inhibin. So as the name indicates, somewhere it can inhibits. Okay, it is secreted from the corpus luteum, so as well as the known as the growing follicular cells or granules of the cells. Along with it can secreted from the corpus luteum. This inhibin, it was mainly secreted the FSH and LH. Inhibin, it was mainly secreted the FSH and LH. So this decrease FSH LH, it is required to avoid the ovulation further during the pregnancy. So that is the work of the inhibin. So inhibin, it inhibits the release of FSH and LH, and lack of FSH LH, the ovulation do not occur. So like that in the pregnancy, the inhibin is also play an important role in the female reproductive system. So like that, so these are the various hormones, they like estrogen, progesterone, relaxin and inhibin. So they are play an important role in the female reproductive system, and also so they are involved in the regulations of the female reproductive cycle, like a changes in the ovarian cycle that was helpful for the maturations of oocyte or release of the ovum, and as well as so they causes the change, especially the development of the endometrium. It can create a favorable environment for fertilized ovum. If it is not ovum is not fertilized, then endometrium can be collapsed or it can be cracked. Then small fibrins of the endometrium, so they are responsible to cause of the menses or menstrual flow. So that both event or both cycle, so that was occurs under the influence of the or changes the concentrations of the estrogen, progesterone, relaxins, so as well as the inhibin. So now we can discuss regarding the phases of female reproductive system. So female reproductive system, it mainly consists of 4 phases. Female reproductive system cycle means it is a combinations of ovarian and uterine cycle. That is the various hormonal changes or regulations of the changes in the ovaries as well as the uterus. So that is the combined events. So that was known as the female reproductive system, and those events, so they are mainly categorized into 4 classes or 4 phases. First phase, so that was known as the menstrual phase. The durations of the menstrual phase is 1 to 5 days. So during this period, the menses can be occurs or menstrual flow can be occurs along with the blood and thread of the endometrium and unfertilized ovums. Okay, unfertilized ovum is also present in the menstrual flow. Okay, so that phase is occurs between 1 to 5 days or 1 to 7 days if the cycle is 28 days cycles. Okay, so that flow of the menses or menstrual cycle from the vagina, so that period was known as the menstrual phase. The next one, that is the pre-ovulatory phase. So as the name indicate, in this phase, so whatever the ovulation is required the favorable environment, that the change in the fallopian tubes or change in the uterus, so that preparation is occurs in the pre-ovulatory phase, and duration is 6 to 13 days if the cycle is a belongs to the 28 days once again. Okay, so next one is the ovulation. It is occurs exactly, that is the 14th day if the cycle is 28 days. So on the 14th day, when the menses is occurs after the 14 days, so that is the period of the ovulation, or generally 12 to 15 or 16 days. It is considered as the ovulation period. Okay, so where only ovum can be released, where only if the ovum can guard the sperm, then only it was fertilized. Otherwise, it cannot got the sperms means then fertilization is do not occurs. So that ovum can excreted through the menses or through the menstrual flow. So that ovulation is occurs in the 14 days ovulation, nothing but the release of the ovum into the fallopian tubes. Okay, so next there is the post ovulatory phase. So that was occurs in the day that is after the ovulation, that is 15 day to 28 days if the cycle is once again the 28th days. So that is the post ovulatory. So phases, that was once again the changes in the uterus or ovarian cycle that you can increase the hormone levels or development of endometrium. So that was create the once again the favorable environment for the fertilizations for the development of the embryo or ovum. So that period is known as the post ovulatory phase. So like that, the female reproductive system, if it is a 28 days means it can categorize into 4 phases. So these are the durations. So next ones we can discuss regarding the menstrual phase. So the menstrual phase is also known as the menstruations or menses. Okay. So the durations of the menstrual phase is 1 to 5 days of the cycles. So in the menstrual phase, so we can discuss regarding the event or changes so that was occurs in the ovaries. Okay, so dear students, so already you know the ovary, so they are consist of the follicles, that is the unmatured follicles, and those are so known as the primordial follicles. Okay, so under the influence of the FSH, that is the follicular stimulating hormones, so these primordial, that is the primordial follicles, so they are developed into a primary follicles, and further under the influence of the same FSH hormones, so these primary follicles, so they are developed into a secondary follicle. So like that, so these events, so that was occurs in the menstrual phase within the 1 to 5 days. So where the primary primordial follicles, they are developed into secondary follicles, but same cycle, so these secondary follicles is not responsible for ovulation, because this process, that the conversions of development of primordial follicles into secondary follicle, then matured follicle, that was required the several months. Okay, so after several months only, which menstrual cycle flow can be occurs, were only their releases. Okay, so that's why they require the more time. Okay, so that was occurs under the influence of the FSH. So the development of completely secondary follicles, so that was required the several months. So due to that reason only, so whatever the follicles, so they are developed in the this phase, so they are not released in the same phase. Okay, in the menses, after menses, the ovulation is occurs, pre-ovulatory, after ovulatory, then where the ovum can releases. So whatever the secondary follicles are developed in this cycle or in this month, suppose you think this is July month, so whatever the secondary follicles are developed in this July month, so those do not responsible for to formations of the ovum, because only one reason, so they are required the more time, more months, so that's why, so they are releases in the respective cycle after several months, after several cycles. Okay, so these are the changes. So where the primordial follicles converted to primary follicles, and primary follicles are converted into secondary follicles under the influence of the follicular stimulating hormone. So now we can discuss, so regarding the changes in the uterus. The same time, the uterus is also prepared for the menstrual phases. Okay, so during the menstrual phases in the uterus, the estrogen and the progesterone level is decreases. Okay, so decrease the estrogen and progesterone level, the further the proliferations of endometrium, simply the development of endometrium can be stopped. Then this can causes the breaking of the endometrial wall into the uterus. So that's why in the menstrual flow we can got the fine threads of the tissues. Nothing but, so these are the breaking of the endometriums of the walls of the uterus. Okay, and where the estrogen level and as well as the progesterone level is decreases. Okay, so this estrogen, it was causes the or it can stimulate the release of prostaglandin. So prostaglandin is a local hormone. So local autocytes, it means they synthesize in the particular places, so they can show the actions on the particular places, as well as so they are metabolized in the particular places only. Suppose in here, so they are synthesized in the uterus cell and released from the uterus cells and shows the actions in the uterus cell, as well as so they are metabolized in the uterus cells only. So that's why, so they are known as the local hormones or autocytes. So here the estrogen, it can stimulate the release of the prostaglandin. So that released prostaglandin it was causes the contractions of the uterine spiral arterioles. So due to contractions of the uterine spiral arterioles, it can causes the menstrual flow. Okay, so due to menstrual flow or contractions of the spiral arterioles, so where the deficiency of oxygen is taken place in the uterus. Okay, so due to deprivations of oxygen, once again it can favor the menstrual flow, and as well as the deprivations of the oxygen, so unfertilized ovum, so that was died due to deprivations of oxygen, so that was secreted through the menstrual flow. And the menstrual flow, it was mainly consist of the 50 to 150 ml of blood, and as well as it consists of the tissue fluid and mucus and also epithelial cells said with the endometriums. Okay, so this is the structure. Okay, that was easily helpful for you peoples. So that is the, if the menstrual cycle is normal, then menstrual flow, so that was seen in the every month in the correct times. Okay, so that is about 50 to 150 ml the menstrual flow can be produces. Okay, in some females, okay, even in the menstrual phases, the menstrual flow is not occurs or menses does not occurs. Okay, it is not indicate the menstrual cycle is absent or it can abolishes. It is not like that. If the ovum is fertilized means then only the menstrual flow is not occurs. If ovum is not fertilized, then also the menstrual flow is not occurs. So what you can don't worry about that. If you are faith on yourself and your patients, so then that is not menstrual flow was responsible for the reverse entry of the menses or fluid into the ovary or in the pelvic regions due to certain conditions, okay, or due to smaller opening of the cervix. Okay, the cervix is the one place it can create responsible for, it can helpful for open the uterus in the vagina, so that was helpful for the flow of the menstrual flow. If the cervix size is small, then so that menstrual flow is not occurs in the normal range, that is the around 50 to 150 ml of the menses is present, fluid is removed from the female body during the menstrual phase due to short size of the opening of the cervix, so that fluid can return into the body towards the ovary through the fallopian tube, then enter into the pelvic cavity, so that was known as the retrograde menstrual flow. So that's why few female, so they will be having the less menstrual flow, and few female, so they having the more menstrual flow or normal menstrual flow. If you having the normal menstrual flow, you don't worry regarding that one. So it is how much. Okay, if you having the abnormal menstrual flow, so there is no flow is there, so that indicates it is a retrograde menstrual flow, so that fluid can return back to the ovaries, from the ovary that can return into the pelvic cavity. So due to that, so the more abnormal pain is present during the menstrual cycles. Okay, so those female or girls, so they having the more pain in the menstrual cycle means during the menstrual phase means, so that was responsible or due to only re-entry of the menses or fluid. Okay, so that was treated simply by taking the Maptal's pass. Okay, so Maptal's pass, so it is the one of the medicine, so that was helpful for to treat the whatever the pain, so that was occurs in the menstrual phase. You can should be remember that is the Maptal's pass is the first liner drug. Okay, so that was treated and it should be take because this mephistopheles pass, it is a anti-inflammatory agent. So due to entry of the fluid in the pelvic cavity, so that was also responsible for to cause the inflammations in the pelvic regions. If it is not treated by use of the mephistopheles pass, okay, so then it was responsible for the development of the endometriosis. It is the abnormal conditions of the endometrium. So that was known as the endometriosis. If still, if you are not consult to the doctors, so then or physicians, so then so that endometriosis is responsible for to cause of the infertility in the females. So already you know some female having the menstrual cycle still, so they are suffering from the infertility. Okay, and as well as it was responsible for to cause of the cancer. So that's why if you any abnormal menstrual flow, if you are suffering from the retrograde menstrual flow, if you are suffering from the more pain during the menstrual cycle, or even the more fluid, that is the blood when seen in the menstrual cycle flow, then you can consult the your family doctors. Otherwise, so that was responsible for the cause of the, if the blood flow is more means anemia, if it is less and retrograde menstruation flow is present mean that was responsible to cause of the pelvic cancer or uterus cancer or ovary cancer or fallopian tube cancer, or it was responsible to cause of the infertility. So that's why you should be always touch with your family doctors. So next one we can discuss regarding the pre-ovulatory phase. As the name indicate, it is the phase where the preparation is occurs in the ovaries as well as in the uterus for the process of the ovulations. Ovulation nothing but release of the ovum into the fallopian tubes. So that is known as the ovulation. So certain preparation, so that was required in the uterus as well ovaries. So that phase is known as the pre-ovulatory phase. So exactly it is the time between the end of the menstruation and ovulation. So that period is known as the pre-ovulatory phase. Okay, so exact duration, if the cycle is 28 days means that is the 16 to 13 day. So that is the exact period of the pre-ovulatory phase if the cycle is a 28 day. Simple. So first we can concentrate on the events in the changes in the ovaries. In the ovaries, simple, the secondary follicles, so they are further developed into tertiary follicles. So under the influence of the hormones, so they are developed into tertiary follicles, and these tertiary follicles are known also known as the dominant follicles. Okay, so in the ovaries, so single follicles will be selected from this cohort to become a dominant follicle, because many follicles so they are developed, many secondary follicles so they are developed. Only the single follicles which is further considered for the selected automatically by our body or ovary. Okay, so as it is known as the cohorts, so it becomes the further development involved in the further development, then it is known as the dominant follicles. Okay, so dominant follicles secrete the estrogen as well as inhibin and decrease the secretions of luteinizing hormones, because so here the estrogen it can give the positive feedback mechanism, that is the message to the hypothalamus, then hypothalamus and pituitary gland they can stop the secretions of the luteinizing hormones. And among the secondary follicles, so 90% follicles, so they are undergo the apoptosis or programmed cell death only by even becoming the meiotically component. Only one or few, so they are come to the forward. 90%, so they are died. So whatever, so they are developed during the so the first phase or also in the these events. Then So from the one of the secondary follicles, it becomes the further it can develop and it becomes the dominant follicles, are also known as the tertiary follicles. Okay, so these dominant follicles further it can develop, then it can becomes the mature follicles, are also known as the Graafian follicles. Still, it is the development is continue. Okay, and these Graafian follicles, so these are also secrete the estrogens. Okay, so that level was increases maximum in the 12th day. So where the high level of estrogen is present if the cycle is the 28th day. So when these matured follicles are Graafian follicles, they are continued developed under influence of the estrogen and influence of the progesterone. Their growth is continue, and the proteins, when their size become the 20 millimeter, then so these Graafian follicles, so that was ready for the ovulation, are ready for the release of the ovums. And these other side, so these mature Graafian follicles, so they becomes the blister like bulb due to swelling in the antrum on the surface of ovary. Okay, so with reference to the ovarian cycle, so this pre-ovulatory phase is also known as the follicular phase, because completely the follicle development and the denaturation, so that was taken place in the ovary. Only one secondary follicle that can dominate, that can become the dominant follicles, and as well as the mature or gamete follicles. So that's why completely it was involved of the. So in the ovaries, so complete it can concentrate on the development of the follicles, so that was ready for the release of the ovum. So that's why, so this phase, that is the pre-ovulatory phase, is also known as the follicular phase if it is concerned with the ovarian cycle. So next one we can discuss regarding the pre-ovulatory phase. So that was changes or events occurs in the uterus. So as the growing ovarian follicles are there, so they are liberate the estrogen into a blood. Okay, so that estrogen or oestrogen, it can further stimulate the endometrium repair and that is the proliferations. Nothing but it can create, it can increase the thickening of the endometrium. So that can create the favorable environment. Then only whatever the ovum was released, so that can attach the wall of the, or whatever the fusions of sperm sime ovum is caused a zygote, then zygote is developed into blastocytes, then those blastocytes, so they are attached to the wall of the uterus, that is nothing but endometriums. So certain changes is required on the endometrium, so that changes is occurs due to repair and as well as proliferations of the endometrium under the influence of the estrogen. So that estrogen, so that was released from the growing ovarian follicles. So what are the follicles? So the ovary is present, so they can release the estrogen. So that estrogen release into the blood. From the blood it can reaches to the uterus wall. It is also well circulated, well connected with the blood vessel, and then that estrogen, it can stimulate the further development of endometrium regarding the repair and proliferation. Then only it can create the favorable environment, okay, for the ovums, if it is fertilized or not fertilized. Certain changes is required. So that changes or preparations are in the uterus, so that was occurs in the pre-ovulatory phase under the influence of the estrogen. And as well in another side, the glands of the endometrium, so they become the straight. So you can see in here, some they are become the straights. Okay, okay, so these are straight in this phase and parallel to one another, then they and contain the little secretions. Okay, so with reference to uterine cycle, so the pre-ovulatory phase is also known as the proliferative phase. So like that, if we discuss regarding the pre-ovulatory phase regarding in the uterus, then it was known as the proliferative phase. Proliferation means multiplications of the cell or development of the that particular part or repairing of the that particular part. So that was create the favorable environment for that new things or that organs or that phase. So that's why certain changes is occurs in the uterus. So that's why, so this pre-ovulatory phase with reference to the uterine cycle, it is known as the proliferative phase. But reference to the that is the ovary cycle, that was known as the follicular phase. So that's why the pre-ovulatory phase is also known as the follicular phase and as well as proliferative phase, where the maximum the development is occurs in the both case ovaries as well as in the uterus, where the follicles are developed in the ovaries, in the uterus the endometrium was repaired or developed. So next one, so regarding the ovulation is nothing but the release of the ovums. Okay, so when the graphene follicles or mature graphicle reaches to the maximum 20 mm, okay, so their diameter, so they are continuously developed under the influence of the estrogen, progesterone or hormones of the female reproductive system. So their size when they reaches to the 20 mm, then they was responsible to cause of the ruptures of the mature graphene follicles. Okay, when they reaches maximum 20 mm in the diameter, so they are then they are considered for the ready for the ovulation, and that 20 mm size, that is also depending upon the estrogen. Okay, and estrogen level, so that was depending upon the pituitary gland, and pituitary gland, that was depending upon the hypothalamus, and hypothalamus function, so that was depending upon the cerebral cortex, and cerebral cortex function or cerebrum function, so that was depending upon the our mental conditions, our activities, so how we are there. Okay, if you are under the stress, under the living in the stressful life, or any disorder or agitations or anxiety in the CNS or in the body, so that cannot concentrate on the secretions of estrogen, and lack of estrogen, then ovulation is do not occur, and lack of ovulation, okay, then fertilization is not here. The ovulation, it was concerned with the ruptures of the mature graphene follicles, so that was released the secondary oocyte into a pelvic cavity or near the borders of the fallopian tubes, and from the that release that is the oocyte, so that get occupied by the infundibular or that is the fibrae of the fallopian tube, it can pick up the those ovums, okay, from the pelvic cavity that was released by the ovary during the ovulation, and it occurs exactly on the 14th day if the cycle is 28 day cycle, and easily you can monitor. So when the ovum is released in your body, simply by monitoring the body temperature. So during the ovulation, 1 degree centigrade of body temperature in the female, so that was increases. Regularly you can concentrate on your, or when your menstrual cycle is started, you can observe your temperature. Okay, so during the menstrual flow, you are agitated, you are shoutings. But during the release of ovum, so that was occurs on the 14th day, when the menstrual cycle will be started after the 14th day, or simply if it is irregular, if it is not the 28-day cycle, then it is the considered the 14 to 16 day. So the indications of the ovum is simply 1 degree body temperature was increases. So when your body temperature increases, on that day it can indications of the ovulations or indications of the release of ovum from the ovary, so that can enter into the fallopian tubes and waiting for the sperms. Okay, so where if you avoiding, if you don't want to go to the child means, so where you can avoid the sex. Otherwise, you can got the sperms, then it was fertilized and responsible for the development of the embryo or gestations. Okay, so that was easily identified by monitoring the body temperature. So 1 degree temperature can be increases. So during this period, the estrogen level causes positive feedback mechanism sent to the our hypothalamus. Then so that hypothalamus can secrete the LH and as well as GnRH. So these GnRH, LH or LH especially, it was responsible to cause of the ovulation. So this is the figure. So that was easily you can see that is the GnRH. Then here estrogen give the positive feedback because of the hypothalamus. Then hypothalamus release the GnRH and GnRH reaches to the our antipituitary gland. Then antipituitary gland release the FSH and LH. Among LHs, so it can enter towards the ovary and release the ovum or release the or cause the ruptures of the Graafian follicles, then helpful for the release of the ovum from the matured Graafian follicles. Okay, so after release of the ovum from the those Graafian follicles, and those Graafian follicles are known as the early antrals, and later on, so these antrum and theca cells, so they are collapsed together, so they become the further mature follicles. Okay, so next one we can discuss regarding the positive or the sorry post ovulatory phase. So this is the phase, so after the ovulations. Okay, so that period is known as the post ovulatory phase. So it is the time between ovulation and onset of next menses or menstrual flow. So that period is known as the post ovulatory phase. If the fertilization is occurs means, then it was helpful for the development of the embryo. If the fertilization is not occurs means, it was responsible for removal of the unfertilized ovum in the form of the menses. Okay, certain changes will occurs in the both ovary, so as well as in the uterus. And the durations of the post ovulatory is 15 to 28 days if the cycle is the 28 days cycles. So first we can discuss regarding the changes in one ovary. So already you know, so at a time each ovary do not involved in the ovulation. In 1 month, so left ovary is involved means in next month the right ovaries are involved. So that's why here I am putting the point I regarding the changes in the one ovary. So here, so after the that is the release of ovum. So those mature follicles regarding the antrums, okay, so as well as then the theca cells, so they are shrinkage. So due to that, they are collapsed the that is the mature follicles due to internal breakdowns of the that is the antrum as well as the theca cells that was responsible for to collapse of the mature follicles. So that collapsed mature follicles responsible for release of the small amount of blood. Okay, so due to ruptures of the internal environment of the mature follicles due to release of the ovum, so small bleeding is occurs, small. So that small bleeding is responsible for to cause of the blood clot. Okay, so due to cause of blood clot, so that ruptured Graafian follicles is known as a corpus hemorrhagicum. Okay, so this is the structure. So here the ovum is religious. One small clot is occurs. Okay, inside the Graphian follicle due to that is the ruptures or breakdowns of the internal components of the mature follicle, then small bleeding responsible to clot. So due to that cell is known as the corpus hemorrhagicum. Okay, so this corpus hemorrhagicum under the influence of the once again luteinizing hormones. Okay, in the ovulation phase, so that was estrogen. It can give signal to the hypothalamus. Hypothalamus can releases the LH. So this LHS one side induce the ovulation, and another side it can involved in the development of the corpus luteum from the matured damaged mature follicle cells or Graafian cells. Due to collapse, bleeding occurs due to bleeding. So they are known as the corpus hemorrhagicum, and under the influence of LH, so they are further developed or converted. So they are become the corpus luteum. So corpus luteum is the one type of the cells in the ovary. So that cell is only involved in the secretions of the progesterone as well as estrogen, inhibin and relaxin. So these progesterone, estrogen, inhibin, relaxin, so they are play an important role in the development of the embryo if fertilization occurs. And fertilizations of the ovum with the sperm, that was occurs under the influence of the estrogens. And after that, so that ovum can enter in the uterus involved in the development. So that was occurs under the influence of the progesterone. And inhibin, further it can release of ovum by giving the signal or inhibiting the release of LH and FS. And relaxing, it was relaxes the smooth muscles of the around the pelvic cavity. Then the uterus can be enlarged. That was helpful for the easy delivery, and as well as that was helpful for the development of the embryo. And these hormones, so they are secreted from the corpus luteum. And dear students, the life of the corpus luteum is only 2 weeks. Okay, after 2 weeks, so they are a shrinkage and they becomes the corpus albicans. And corpus albicans, they do not involved in the secretions of the any hormones regarding the estrogen, progesterone. So they do not secrete it. So after the ovulation, only 2 weeks, the corpus luteum that was involved in the secretions of the hormones. Okay, so after 2 weeks, so that corpus luteum, so the secretion was decreases. Then that corpus luteum cell that was known as the corpus albicans. Okay, so your scenario is there. If fertilization is not occurs, okay, if the fertilization is not occurs, definitely the corpus luteum becomes the corpus albicans. Then that ovum it do not got the hormones, then where oxygen deprivation is occurs, the ovum can be die. Then what it was secreted from the menses or menstrual flow. Suppose if you think the fertilization is occurs, so due to fusions of ovum and sperm, okay, they can form the zygote. So then the zygote or during the fusion, so that was responsible for secretions of one hormone. So that was known as the HCG, that is the human chorionic gonadotropins. Okay, so this hormone, if it is secreted in the uterus of the female only after the fusions of the sperms with the ovum. So after exactly the fusion occurs after the on the 8th day, so the uterus it can got the HCG, that is the human chorionic gonadotropins hormone in their uterus. And the life of corpus luteum is 2 weeks, any 16 days. If it is not fertilized, then after 16 days it becomes the corpus albicans. If it is fertilized, then the uterus or your corpus luteum that can got the this hormone, because this hormone releases on the 8th day of after the fertilization. And this HCG, it can maintain the life of the corpus luteum, or it can further stimulate the secretions capacity of the corpus luteum. And due to presence of HCG, the corpus luteum do not become they do not convert into corpus albicans up to the delivery. So these corpus luteum, so they are involved in the secretions of the progesterone, estrogen, inhibin and relaxin. So that was helpful for the development of the embryo or development of the womb. So like that, if the fertilization occurs means the functions of corpus luteum that was continue, that was involved in secretion of the all the hormones. If it is not fertilized, then it becomes the corpus albicans. Then the next time after 28 days the menses is occurs, and after menses occurs once again the cycle was repeated. Okay, cycle was repeated. So due to that only the pregnancy it was confirmed by detections of the HCG. So what are the kit available in the market? So the commonly known as the Velocit kit. So that kit is helpful for the detections of the pregnancy. Okay, that is the confirmations of the fertilization. If it is an unsafe sex, so where so they want to note down the, or if anyone they do not want to the baby on that particular time, so they need to operation, say they want to confirm so whether the ovum is fertilized or not, so they are using the Velocit kit. So that's why, so when the Velocit kit can give the positive result means, so after 8th day of the unsafe sex or intercourse, after 8 days only, so these hormones is found in the uterus or in the urine, and that kit one detect the by using the urines of the female and put you can got the positive or negative. Okay, so that's why after sex immediately do not go for the test. We can wait for the 8 days if it is unsafe sex, or if it, on that time if you are on the family plannings. Okay, so where you can wait for 8 days, and after the 8 day we can got the exact result, because this HCG is present, and this HCG is helpful for to maintain the secretory activity of the, this is the corpus luteum. And to overall it was concentrates on the developments of the luteums or maintain the property of the luteum. So that's why with reference to the ovary cycle and post ovulatory phase is also known as a luteal phase, because it only concentrate on the, or only the changes will be occurs in the corpus luteum in the ovary. So that's why with reference to the ovary cycle, the post ovulatory phase is also known as a luteal phase. So next one we can discuss regarding the changes in the uterus during the post ovulatory phase. So first changes that was occur in uterus, the corpus luteum, it can secrete the estrogen and progesterone and promotes the growth and cooling of the endometriums. Because the life of the corpus luteum is 2 weeks. Up to 2 weeks, it can produce estrogen and progesterone. It can promote the growth and cooling of endometrium, and also it can stimulate the thickening of the endometrial wall that was required for the to create the favorable conditions for to welcome the fertilized ovumes or growth of the fertilized ovum. And second events, so that was occurs in the uterus during the post ovulatory phase is the endometrium gland. So they are secrete the glycogen. Okay, they secrete the glycogen, and glycogen is the source of glucose or source of ATP. Further, it was required for the, that is the development process in the uterus. Okay, so due to secretions of the glycogen in the uterus, with reference to uterus cycle, the post ovulatory phase is also known as the secretory phase. So that's why the post ovulatory phase is also known as the luteal phase and as well as secretory phase. Okay, so then the third event, if fertilization occurs, then okay, so there is no problems. So then further the corpus luteum's secretions functions was maintained, that it was continued involved in the estrogen progesterone that was helpful for development of the womb, even that it can supply the continuous ATP. So this is the reason only during the pregnancy the female will be suffering from the diabetes mellitus, the diabetes mellitus or hyperglycemia, that was known as the gestational diabetes mellitus. Okay, so that's what doctor, so they continuously they monitor the blood sugar level in the pregnant woman, because in the pregnancy these corpus luteums their functions continue going on, and that's why the endometrium glands they are continue to secrete the glycogen. So due to secretion of glycogen the more glucose can be found in our blood. So that's why that pregnant woman, so that lady he is suffering from the diabetes mellitus. So that type of diabetes mellitus is known as the gestational diabetes mellitus, but it can reverse after delivery. So the change of the food style, or during, if it is uncontrolled in the pregnancy, then the doctor they use the medications, glibenclamides, or if it is still more uncontrolled, that they can give the insulin also. That is depending upon your family doctors. So they can want to control the sugar level. If it is up to optimal, then they don't worry about that. Then after the delivery, so they are concentrate on the, once again they give the anti-diabetic drug or any therapy, so they can control the diabetes mellitus. If it is not treated, not consulted with the doctor, then that woman's become the diabetic patients due to only. So this is the secretions property of the endometrium gland. If it is fertilized, there is no problem regarding the glycogens. Okay, if it is fertilized, sorry, if it is not fertilized, there is no problem regarding the glycogen, can cause the decline of estrogen and progesterone level, because after 2 weeks the corpus luteum stop their secretion, day by day their level was decreases. If it is not fertilized, if it is not got the HCG, then the estrogen progesterone level is decreases due to decrease the progesterone level, the are due to degenerations of corpus luteum, the estrogen progesterone level is decreases. So that was responsible for to cause of the menstruation and menstrual phase. Then the menstrual phase is begins. Okay, if it is fertilized, then the menstruation do not occurs. What are the hormones releases? So they are involved in the development of the, so like that. So the female reproductive system, sorry, female reproductive cycle, so that will be having the 4 events. That is the menstrual phase, pre-ovulatory phase, ovulation phase, as well as the post-ovulatory phase. So next one, so regarding the menstrual cycle, it is the part of the, that is the female reproductive cycle. So I have only here highlighted for you. So menstrual cycle is defined as a cyclic event that can take the place in a rhythmic fashions during the reproductive period of the woman life. So menstrual cycle, it was start at the age 12 to 15 years, which marks the onsets of puberty. The commencement of the menstrual cycle in the female is known as the menarche, and that woman or fertilized woman is known as a menarche woman. And the menstrual cycle that was ceases at the age 45 to 50 years, the permanent cessations of the menstrual cycle in old age, so that was known as the menopause. The menstrual cycle that was stopped naturally in the age 45 to 50 years, as well as, so during the pregnancy the menstrual cycle is also absent, or due to certain psychological disorders or certain during certain therapy, then also the menstrual cycle is absent. You should be remember, in the case of pregnancy or due to age or due to any therapy, so where the menstrual cycle can be stopped. If it is related to the age, so you don't worry. If it is related to pregnancy, still you do not concentrate, because you are already confirmed you are the pregnant or that your patient was pregnant. If it was abnormally stopped, then you can consult your doctors. Otherwise, it was maybe due to retrograde menses or any other problems or due to that therapy. So then the doctors or family doctors, they will be otherwise that female in future, that female become the infertiles. Okay, so the female become the infertile. So that's why you can concentrate. If it is normal, if it is stop in the age of 45 to 50, then that phase is known as the menopause or condition of menopause, or that woman is known as the menopause woman. Then the durations of menstrual cycle is a 28 days, but under physiological condition it may be 20 to 40 days. And also as the age is going on, the durations of menstrual cycle is also increases. That is also you can considerations when any patient is consult with you. Okay, also you can account the that is the age. As the age going on, the irregularity in the menstrual cycle is increases. If having the 28-day age menstrual cycle means, so that is the normal menstrual cycle. So these are the hormones that was influenced in the menstrual cycle. That is the FSH, LS, estrogen, progesterone. Their role already we discussed in the respective reproductive cycle phases. Then the phases of menstrual cycle, they are there is a menstrual phase, proliferative phase, ovulation, and secretive phase. So these phase, this is considered completely changed in the uterus. It is the menstrual cycle phases. Okay, so remaining we will be discussing.